Hey guys, it's Leah Buckles from Prestige Worldwide Medical Consulting. I wanted to come on really quickly today. I haven't done a video in a while. I want to come on and talk a little bit about headaches and the different types of headaches that we see when we're helping veterans with medical opinion letters. So I guess to just jump straight into it, there's like tons of different types of headache disorders that veterans can suffer from or that people can suffer from. Many of you probably have heard of things like migraine headaches, tension headaches, things like that. Those are some of the types that we see very frequently, but there's a few other types as well. So I wanted to, let me see if I can flip my camera screen here. So here's just like a little slide that I put together. Oops, sorry for the technical difficulties. That kind of shows some of the headaches I'm going to be talking about. Migraine headache, tension headaches, cluster, sinus, like non-specific headaches. There are some veterans that have headaches related to Gulf War exposures, blood pressure related headaches, and many more. This little cool diagram here kind of shows the types of headaches that people get and the areas that they experience them in sometimes. So migraines, as you can see on the end there, they're typically unilateral, meaning one-sided. And they are, as you can read, can be accompanied by nausea and vomiting or visual changes. Sometimes people talk about an aura that can present prior to, a veteran is going to see flashing lights or feel a certain sort of way before they, so they know it's kind of coming on, right? So typically those are one-sided, left or right. Tension headaches, as you can see there, are kind of band-like, and people would describe them as like I said, band-like or squeezing the head, and just like tense muscles maybe in the back of the head, things like that. Cluster headaches, these are not quite as common, but we still see them. You can develop pain around the eye, and people describe them as an ice pick type of headache. Ice pick headaches, that's one of the common phrases we hear. Sinus headaches, usually kind of, right behind the cheekbones and hang on, I'm gonna flip again. Okay, so, with sinus headaches, people will be like, oh, I'm having sinus headaches, or it hurts here, or whatever, and it's usually accompanied by those sinus symptoms, right? So I think the most common ones I see veterans, not just veterans, but when, I was practicing clinically in family practice, things like that, migraines are pretty common. I actually suffer from migraine headaches as well. There's lots of different treatments. Some people will be on what's called an abortive medication. Most people will be on that, and that's what you take when you actually when you're getting the headache. So you'll take like, some people will take sumatriptan, or it's called Imitrex, Maxalt, different types of medications like that. Tylenol is an abortive medication. It's something that you take to get rid of the headache right then and there, right? And then some people will be on preventative medications that, if they're getting headaches frequently enough, their doctor may decide to put them on a medication to take daily so that it can help prevent those headaches from coming. If you only get one migraine a month, they're probably not going to put you on a prevention medication. But if you're getting them 10 times, several times a month, several times a week, they may consider that. And there's lots of different medications they can put you on for prevention. Some people even get Botox. That helps some people. Outside of that, tension headaches, again, those are generally stress related. Now, that doesn't mean that, migraines can't be stress related. We see that quite frequently as well. So tension headaches are usually bilateral band-like headaches. And then those cluster headaches are going to be those ice pick type headaches. So what are some of the things that we see them service connected to? So, it really just depends. Like a lot of people say tinnitus stimulates their headaches, right? They have really bad tinnitus. It causes them to have migraines, things like that. Sometimes stress, if you're service connected for PTSD, anxiety, depression, any of those kind of disorders that can cause or aggravate your headache disorder, stress-related headaches. Let's see, the sinus related, like we discussed. Gulf War, I've seen this. It's really a mixed bag what I've seen. Like sometimes I see people try to claim and I'm not an accredited agent or anything like that. I'm just a medical expert, right? I don't get involved in the claims filing process, right? But I have seen veterans successful with migraines related to Gulf War, but I've also seen a lot of them get denied because, the examiner or the rater says migraines are a known condition. It's not an unknown, illness. Likewise, I've seen just generalized headaches related to Gulf War. I mean, it really just depends on the situation. Prostrating, that seems to be a word people throw around quite a bit when it comes to this process. What does that mean? I mean, does it debilitate you? Does it make you unable to function? Are you unable to, I know when I get my migraines, typically I have to take Max Salt, put an ice pack on my head. I have a thing I got on Amazon that's like a cold pack that I put in my freezer. And when I get it, I just put it right over my forehead and I lay in bed for like an hour or two, and then I'm better, right? So are you just knocked out? Like, can you just not function, basically? Those are some of the things that questions I get asked a lot about anyways. So I hope this was helpful. Oh, hypertension. Okay, before I run off. So hypertension can cause, if you've got really bad blood pressure and it's really high, it can cause headaches. I'm not sure if they're necessarily going to be like migraine headaches, right? But you can have headaches related to high blood pressure because that's one of the symptoms. Also, one thing that I notice is that if somebody's straining their eyes a lot, you can develop headaches. So if your prescription's not right on your glasses, something like that, that can be an indicator that maybe you're constantly just straining and squinting because you've got a bad prescription, right? So those are just some tips and some things that I've heard and seen. So this is going to be a quick video. So I'm gonna try to do more videos that are kind of shorter so that I can get more of them in. Usually when I do a video, I spend tons of time preparing them and they're a little bit longer so that I can get out a lot of information. But then I don't do them as frequently because I'm trying to get them to be really healthy and long videos. But I hope to be seeing you guys a lot, more often. If you have any questions or if you have any specific things you'd like to hear me talk about, just drop them in the comments or send me a message and I'm happy to do that. So thanks for tuning in on this short notice. I just jumped on and I hope you guys learned something. Thanks a lot. Have a good day.